Okay, so now let's talk about secondary hemostasis, namely the coagulation cascade. And the end result of this is a cross-linked fibrin clot. So we start out with some damage to the endothelium of a blood vessel, and again we have the exposed collagen underneath. Now clotting hasn't occurred prior to this point because all the clotting factors are moving through here, so they don't really have the chance to stick to anything, and they can't really stick to endothelium. And they all circulate in their inactive forms. But this cascade is the thing that activates everything. So when you have the collagen exposed, you're going to get factor 12 sticking down here, and it gets activated to 12A. Now in the common diagrams that you'll see a whole bunch of arrows going from 12 to 12A, 11 to 11A. I'm going to skip all that to try and make it more simple. 12 will also activate prekallikrein into kallikrein. And this kallikrein can then activate further 12 and activate them to 12A. Kallikrein itself is anchored to the collagen by high molecular weight kininogen. But let's get back to 12. So 12A is now going to activate 11 into 11A, and that is going to activate 9 into 9A, which in turn activates 8, and then 9 joins up with 8 as a cofactor to activate 10. This whole system here is called the intrinsic system, but 10 can be activated another way. Tissue factor, which comes from the subendothelial collagen or even from leukocytes, will activate 7, which can then also activate 10. This little area system is called the extrinsic system. And now we go down the common pathway. 10 is going to activate 5, and then join up with 5 to activate 2. 2A is also called thrombin, and now this is going to go and activate 1, which is also called fibrin. Thrombin is also going to activate 13, which is responsible for cross-linking the fibrin. Thrombin can also activate platelets. Some of these are going to be calcium dependent, like prothrombin and 10A and 7A and 9. So this whole cascade, going whichever way it needs to, is going to end up with that cross-linking of the fibrin, which helps us form the clot. So this whole coagulation cascade just strengthens that clot. Now we talked about 2, 7, 9, and 10 as being calcium-dependent factors, but there's another thing that they share, and it is that they are vitamin K dependent. So off in the liver, glutamic acid, oxygen, and carbon dioxide turns into carboxyglutamic acid, and that's responsible for making the factors 2, 7, 9, and 10, as well as proteins S and C. And that process here requires taking reduced vitamin K into oxidized vitamin K. This is then recycled back into reduced vitamin K by vitamin K reductase. I know what you're asking. Why are you telling me all this? Well, it'll be clear in a second. But before we go there, let's look at one more thing, how some of these clots are broken down. Now this kallikrein is also going to activate plasmin. And plasmin is going to break down fibrin into fibrin degradation products, one of which is our good friend, the old D-dimer. Proteins S and C also will activate plasmin. And so this whole pink process is responsible for the breakdown of clots. Alright, so this is the coagulation cascade. Now let's look at how we can mess this up. The most familiar anticoagulant that people know is warfarin or Coumadin. And warfarin inhibits this vitamin K reductase. So without vitamin K reductase, this whole other process couldn't happen, and so you don't have 2, 7, 9, and 10, as well as S and C. So warfarin was going to interfere with the coagulation cascade by eliminating these factors. The next most common anticoagulant people know about is heparin, and its low molecular weight heparins as well. And they work with antithrombin 3 and will inhibit 10. So heparin inhibits the coagulation cascade just at the start of this common pathway here. Another anticoagulant that we use is tissue plasminogen activator, or TPA. Actually, we use a recombinant TPA. And as the name suggests, it's going to activate plasminogen into plasmin, which you already know causes clot breakdown. Now, one of the new anticoagulants that's on the market is called dabigatran, or it has a brand name of Pradaxa, and that's used for atrial fibrillation right now. That is a direct thrombin inhibitor. And there's another new one, which is thought to be used for oral treatment of PE or DVT, and that's called Rivaroxaban. And that directly inhibits 10A, as opposed to heparin, which works through antithrombin 3. Rivaroxaban works directly on 10A. And this is the coagulation cascade. Yes, it is kind of complicated, but go through it till you get a good understanding of it. I don't have it memorized, but I do know these drugs and where they act. And we're going to go look at these next in what we do when we have a bleeding patient that is on much of these drugs. How can we fix that? All right, see you in the next video.